And good afternoon, everyone. Thank you for joining us for this, the second section of our Institutes for our Healthy Churches 2030 virtual conference. And we're so glad that you decided to join us today. Before our presentation begin, we want to let you know a few things that you should know. This Institute is one of two concurrent sessions that are taking place at this time. Both sessions will be recorded. The session recordings will be available on our on-demand section within 24 hours. All registered attendees will have access to the Healthy Churches 2030 conference platform and materials for 1 year. During our presentation, we are encouraging you to post your questions in the Q&A box, and our presenters will be able to respond to those questions either visually on camera, or they'll be able to respond to them within that chat feed. But also our chat feature is designed for you to give general messaging and comments during our presentation. And after you finish this session, please take a moment to complete our feedback survey. So at this time, I'd love to turn it over to Dr. LaPrincess Brewer and Dr. Christopher Pullins.
Thank you. Welcome everyone to our Institute at the 2020 Healthy Churches 2030 National Conference. Next slide, please. You can go back one to the title slide. Thank you. Our Institute is jointly sponsored by the Mayo Clinic Center for Health Equity and Community Engagement Research and the Balm in Gilead Incorporated. We are so grateful for our partnership aimed at preserving and sustaining the health of the African American faith community. The title of our Institute is When Disaster Strikes, Is Your Church Prepared? The COVID-19 Pandemic and Beyond. Next slide. We would like to thank Mr. Goodman for that wonderful introduction. I am honored to co-chair this institute with my colleague and friend, Dr. Chris Pullins of Mayo Clinic, Arizona. Next slide. We have a phenomenal panel of distinguished institute speakers for you today. You will receive the word from Dr. Joyce Moon Howard, Bishop Latresa Jester, and Dr. Nicolette Louis Saint. Next slide. By the end of this activity, you all should be able to define the phases of disaster in the context of various potential crises that congregations may face, create an emergency preparedness plan for your congregation that can be utilized in any crisis, and identify essential community resources to assist your congregation in times of crisis. Next slide. The COVID-19 pandemic has had a devastating impact on the Black community. This graphic provides a sobering account of how our communities have been disproportionately affected by the novel coronavirus. Blacks are depicted by the green bar, and you can clearly see the striking disparities or differences in COVID-19 deaths compared to other groups. Next. The death rate for Black Americans is twice that for white, Asian, and Latino Americans. Next slide. And the statistics are not improving for our communities. This update to the prior graph was released last week, and deaths among Black Americans not only continue to rise, but again, significantly outnumber all other groups in the United States. Next. Approximately 21,200 Black Americans would still be alive if they died of COVID-19 at the same rate as whites. These acceptable disparities exist not solely because of a higher proportion of pre-existing medical conditions among Blacks, but also because of pre-existing structural racism and inequities. Next slide. The Black church has not been immune to the devastating impact of the COVID-19 pandemic, as we were also faced with a dual-ling pandemic of racial and social injustice. With death and suffering all around us, we had to hold on to our faith and have called on our churches through virtual means as ongoing sanctuaries of psychological refuge to preserve our mental health. Next slide. I currently lead a program called FAITH, which is an acronym that stands for Fostering African American Improvement in Total Health. It is the first community partnership between Mayo Clinic and local African American churches for heart health promotion. In recognition of the disproportionate COVID-19 cases among African Americans in Minnesota, we knew that we had to act and that we had to act fast. We then repurposed to focus on COVID-19 prevention in our partnering churches. Next slide. We deployed an emergency providing the Preparing Your Church for Coronavirus Planning Manual, developed by the Humanitarian Disaster Institute to 120 African American churches within our network, which represents approximately 12,000 African American congregation members, and provided emergency preparedness starter kits. We also launched a social media campaign on Facebook to share COVID-19 information to the faith community. We had a 30-fold increase in our reach, which was largely because of our outstanding community engagement by our community communication leaders. Next. At the end of May, we unfortunately saw a dramatic drop in use of our Facebook page, which corresponded directly to the horrific death of Mr. George Floyd. Next slide. We developed cultural materials with the Association of Black Cardiologists and distributed a flyer called The 10 Commandments for a Healthy Heart during the COVID-19 pandemic. Next slide. As an extension of our partnership, we established a rapid COVID-19 testing site at a community health center. And the name of the center, let me go back here, sorry. So on this slide, you will see that one of our partnering churches here in St. Paul led by example and established a park and praise in order to keep their congregation safe. So Reverend Runny Patterson of New Hope Baptist Church in St. Paul founded the Park and Praise, which has now been used as a model in other churches within our area. Next slide. Sorry, we then established, a rapid COVID-19 testing site at a community center. We're back on track as a partnership with Open Cities Health Center in St. Paul, Minnesota. And this clinic is so special to us because it was founded in the basement of St. James AME Church by Black women in 1967 and has continued to thrive. It has predominantly African American patients. Next. And we established a drive-through COVID-19 Open Cities, and we use Mayo Clinic labs to process the tests, which reduced the turnaround time for well over a week to less than 24 hours. So it was launched in May and is ongoing. And so far, we've done over 3,000 tests, and about 12% have been positive. And you can see that's dramatically higher than those in the state and within Hennepin County. We also developed to increase uptake of COVID-19 testing and basic preventive practices. Next slide. These are photos from the Open Cities drive-through testing site in St. Paul. Next slide. And this is the infographic that we shared with patients from the clinic and our church partners on COVID-19 prevention. Next slide. We're honored to join forces with the fearless leader of the Balm in Gilead Incorporated, Dr. Preparedness, and our community partners at Essence Magazine to counteract much of the misinformation about COVID-19 being disseminated in communities of color. Next slide. And I will now turn it over to my colleague, Dr. Chris Pullins. Thank you.
Thank you, Dr. Brewer, for that informative introduction. I also want to welcome those streaming online today. It's an honor to once again be asked to participate in the Healthy Churches Pre-Conference Institute, and we definitely want to send a shout out to Dr. Preparedness and the Balm in Gilead. So this slide here, this is just to shed light on the fact that outside of Mayo Clinic Rochester, we also have boots on the ground to mitigate this disproportionate effects of COVID-19 on the African American community here in Phoenix, but also in Jacksonville, Florida. So as you look at the slide, you see Dr. Michelle Halyard and Mr. Marin Kelly, who spearhead the Phoenix efforts. by having Zoom town hall meetings. And similarly, our counterpart, Dr. Floyd Willis, is leading similar efforts down in the Jacksonville, Florida area. And so in each community, we are partnershiping with a lot of the African American churches and other faith leaders to, again, help shed light and give more information on COVID-19 and other topics that are helpful. So as I segue into the introduction of our speakers, I just want to briefly say this, that if there's one thing that 2020 has taught us, it's that whether you live in one of the 7 boroughs of New York or in the Pacific Palisades of Los Angeles, you are not immune to national disasters. You know, the New Testament reminds us that God allows it to rain on the just and the unjust, and that everything that can be shaken will be shaken. And so the question in today, and hopefully we'll get an answer to this, is how do we endure such times? Well, you have to have perseverance and you have to have a plan. And so from a perseverance, we in faith, the hymnal says, on Christ the solid rock I stand, and all other ground is sinking sand. So you have to have not just hope, but an enduring hope. And you also have to have a plan. So you have to be strategic, you have to be intentional. It is no longer business as usual. Habakkuk says that you should write the vision and make it plain so that when others see it, they will be able to run with it. And so we have some capable, distinctive speakers today who will show you what the vision is so that you can run with it and it will be clear. So without further ado, I want to introduce all of our speakers. I will present them in the order that they will speak. They will each speak about for 15 minutes, and then we'll have a Q&A afterwards. Please send questions through the chat while they're talking, and we will make sure that we try to get those questions out to the speakers after they complete their discussions. So first of all, we have Bishop Latresa Jester. She is also here in Arizona, where I am, down in Tucson, where she is the senior pastor of Gideon Baptist Church. This mother of 4 and granddaughter of 6 is a trailblazer here in Arizona. She's had the privilege of serving as many firsts in the state of Arizona. In 2008, she was recognized by the National Baptist Convention USA as the first African-American female installed as a Baptist pastor in Arizona. In 2012, she was appointed as the first female to serve in Arizona as a district overseer of the Full Gospel Baptist Church Fellowship. She then went on to be elevated to a state overseer. And then in 2017, she was consecrated to the office of bishop in the Full Gospel Baptist Church Fellowship International. She's now also granted the honor of serving as the Director of Disaster Services under the umbrella of Full Gospel Cares. Our second speaker is Dr. Nicolette Louissaint, and she serves as the Executive Director of Healthcare Ready, a nonprofit organization ensuring proper healthcare resources are in place to meet the most pressing patient needs before, during, and after national disasters, disease outbreaks, and catastrophic events. Prior to being part of Healthcare Ready, she was a senior advisor in the State Department during the epidemic of 2014 with the Ebola virus. She's got a long list of accomplishments and accolades. She was recently named in the Root 100 Most Influential African Americans in 2020. Our third and final speaker is Dr. Joyce Moon Howard, and she is the Director of Undergraduate Programs in Global Public Health, and she's a Clinical Associate Professor at the College of Global Public Health at NYU. Prior to that, she was at Columbia University. She does a lot of research in the community of color, particularly with a focus on contextual and situational factors associated with health behaviors and HIV and tobacco health outcomes and health disparities among African Americans. So at this time, I am going to give room for Dr. Jester to begin the discussion at this time.
Thank you so very much. And so good afternoon. And to some of you on the West Coast, good morning to you. I am over the top excited to be part of this panel to share one of my passions. As you see on the very first slide where it says readiness is a lifestyle. Let me begin by simply, again, echoing the fact that I have the honor and the privilege of serving as the Director of Disaster Services for Full Gospel Baptist Church Fellowship. One of the things that I think is so important as it relates to who we are in Full Gospel is one, we are not a denomination. We are a fellowship of churches that somewhat combine Baptist and Pentecostal. We tend to call ourselves Baptist-costal. But the thing about Full Gospel and where we are as it relates to the movement of disaster services, we were forced into disaster by an invitation of Katrina. Our foundation, our headquarters was rooted in New Orleans. And when Katrina hit, the city of New Orleans had a plan, but they had not shared it with the people. And so our denomination, our fellowship was forced to kind of move out of the city. But people knew the church. If you've been connected to church any amount of time, you know the church was the original nonprofit. And so they went to church for help, that the church needed help. And so we were in a place as a people where the need was as African Americans, where we just didn't have anything in place to help. And so Ergo came together with other faith-based partners to learn how to work and be able to respond to our people. So it's one thing to have a plan. It's another thing to know how to work the plan. So readiness is a lifestyle. Next slide. So one of the things about the phases of disaster is, this says phases of disaster and the response to the church. The phases of disaster are the same, but this is a key point that I really think is important to share. In all of my years of working in the field of disaster services, I've been an active participant in the field for a little over 15 years. I have never seen a disaster where we were in all phases at the same time. COVID introduced us to coming in and out of every phase all at the same time. Normally, you go from prevention or mitigation to preparedness to response and recovery. But because we were not prepared to properly mitigate COVID, we were not prepared. And for lack of preparedness, our response has been off. And then we are still praying and waiting to see what recovery is going to look like. And so that's what's key about COVID. Again, we are in all four phases at the same time, and that is just not common as it relates to disaster services. Next slide. But let's talk about prevention and mitigation so that you really understand what that is. The power of awareness. That's key as it relates to mitigation, because it is impossible to prevent disasters and or emergencies from happening, but you can lessen the impact of what happened. We call this prayer in the church world. You can't really prevent things from happening, but to be prayed up in operate in the power of awareness of the possibility of what could happen is key for the church. Next bullet. And so knowing the type of disasters are just crucial as it relates to prevention and mitigation. In my introduction, it was stated that I am from Arizona. And so one of the disasters that we deal with so much in Arizona are wildfires. As much as we need to have knowledge of hurricanes, we don't do a whole lot of training of hurricanes in the area, because that's not the type of disaster that we're going to see happening on a regular in Arizona. Next bullet. But here is a place that I think is so important for every person of faith, for every person to be able to go to a website that says what could happen in my area. Ready.gov is really a FEMA website that they've made available to you. Can go there and say, this is where I am. It's going to talk to you about the type of disasters that could happen in your area. And then you begin to put a plan together. I think that that is key from a believer standpoint, to first know what could happen and then be in place to know how to respond to what's happening. So remember that. Remember ready.gov as it relates to just getting into a place of understanding what could happen. Next bullet. This is important. This is so important as we look at prevention and mitigation, because Red Cross, again, one of our partners, has an alert app. I believe that's what it is. It's an alert app that when a storm is coming your way, it is going to alert you that it's coming. Listen, again, it's been clear that I'm a woman of faith. Wouldn't it be something if we had an app that told us a storm was on its way, and it would put you in position to prepare for the storm on its way? We call that discernment in the spirit realm. But American Red Cross has an app that when a storm is coming your way, regardless of where you are, the storm will let you know. That's a level of prevention or mitigation, that you know that it's on its way, and then we'll talk about what to do when it's on your way. All right. So listen, we're gonna figure out a way to do that in the spirit realm, but in the natural realm, they have an app that's going to help us. Next bullet, please. This is what's key. In order to really, really be prepared, you have to start at home. Now, we're talking about the church, but the church is a makeup of all of our homes. We've discovered that since we've been forced to worship at home, that your church became wherever your house was. And so if you're really going to be prepared, if you're really going to understand prevention and mitigation, you first have to be aware of what could happen at your house, because the more prepared you are at home, the less work we have to do, or more prepared you are at your house, the less work we have to do at the church house. So to be able to mitigate the possibilities of what could happen at your own house is so very important. So remember that. Start at home. Next slide, please. And so after we get through a place of prevention and mitigation, the next place that we go to is preparedness. Next bullet, please. And so here, grab this. If you stay ready, you don't have to get ready. Goes back to the fact where I says that readiness is a lifestyle, so that when you are at a place of staying ready, you don't have to try to get ready, because you are always in a place of, again, once you understand the possibility of what could happen, you get to a place of, now how am I going to work the possibility? So preparedness is, I'm now aware of what's going to happen, and then I'm going to prepare for the possibility of what's going to happen. Here, let me see if I can put it to you like this. The Bible declares, I believe it's in Matthew 24:36, no man knows the day or the hour that he's going to come, but we live our lives in preparedness so that when he comes, we are ready. You cannot wait until Jesus comes to get ready, right? So if you stay ready, you don't have to get ready. If we could see that in the spirit realm, you should also be able to see that in the natural. Next bullet, please. Documentation is huge as it relates to preparedness. One of the things that I push to those of faith is, as part of new members class, you ought to introduce your disaster plan. You are introducing it to the members and everything that's going on. An evacuation plan should be part of your new members class. What to do when and if something happens. As you are talking to them and introducing your new partners about the flow of the church, there should be, in the event this happens, this is where we go. In the event that happens, is where. So if you begin to document a plan and introduce that to your partners as they are coming into the church, if you stay ready, you don't have to get ready. So if you do not have a plan as part of your new members class, that is something you need to document, and you can go back to ready.gov and it'll tell you how to put that together. Next bullet, please. So here it is with certification. I think is another important element as it relates to preparedness, because we are connected with partners like FEMA. We are connected to partners like Red Cross, that not only will they help you prepare, they will train you so that you have trained the trainers that are part of your congregation. As new people are coming in, you are training them. They are certified to make sure that you not only have a plan, but that you know how to work the plan. Next bullet, please. I believe it just talks about training, so that you are aware that there is training that is available to make sure the next time a disaster of any type might hit your neighborhood or your congregation, that you are trained and that you are not always waiting for someone to come in and help you, but that you have it amongst your own parishioners to help yourself. Next slide, please. So again, after we go for mitigation, and then you go for preparedness, then you go to the place of response. Listen, next bullet, please. Here's what's key about and next bullet, here's what's key about response. You have to do what you are trained to do. You have to do what you are trained to do. See that little cute little point I have right there? The wrong time to learn to dance is when the party starts. So you cannot learn how to respond once the party is started. You are now at the place of implementing your preparedness and then responding to it. I think it's so key to practice response. It might freak your members out the first time, but what I've done in my congregation is I did a fire drill. Let's figure out how we're going to do this. Sunday morning, there's a fire, and we had to keep people in place that knew that there really was not one, but you can't always wait until it happens to learn how to respond. This is the place where you put things in place to make sure that you are responding effectively before the actual disaster happens. But in the element of response, as it relates to the cycles of disaster, after preparedness, it is now the disaster has hit and I'm in response mode. What do I do once I'm in response mode? One of the things that we teach is in preparedness is you should be prepared to be on your own for 3 days. We try to teach now 7 days because you have no idea when someone's going to show up and help. But if it's the church's position to make sure you are the people or the community that we serve is in position to respond, what is the responsibility of the church to be able to help those that might come to the church to go through the response process? I say this in all of my teaching or training churches, we have to learn how to be like Walmart. We're open 7 days a week, 24 hours a day, and especially in response effort, you can't have hours. You have to always be in place to respond once the disaster happens, okay? And then have a bullet up there. And NIMS. In the world of disaster, we work with acronyms. And so NIMS is National Emergency Management System. The thing about NIMS is it's a method of response. So all of our responders, first responders, those that operate in the police department, fire department, Red Cross, all of us know a system of responding. I think it's extremely important that we get to a place where we train the church on knowing the system. What happens is we have spontaneous volunteers at the church. We have people that want to help, but they're not trained in the system. I press the importance of NIMS as it relates to responding so that we all respond in the same method with those that are responding. It is common that oftentimes if you come to church for the first time, we have church lingo. Well, emergency has lingo. And so sometimes people don't understand the language. So if the church is going to be instrumental in responding, you have to learn the language. And it's beyond high five your neighbor. It's beyond that. It really is a language that we're going to have to learn so that we can respond effectively and be known as someone that can respond as it relates to those that are active in the field. We need the church to get in place where federal government, our local entities recognize us as effective, trained people in the field. And that's important because there's money connected to response if you're trained. if you're trained. But if you're not trained, we go back to the people that we serve to try to get the money. So NIMS and understanding the process of FEMA and what they provide is extremely important. Next slide, please. And so after response, so again, we're talking about the cycles of disaster. So we go from mitigation. Okay, so I'm going to do a needs assessment and kind of figure out what the needs are, what could possibly happen. I'm going to go to preparedness, because now that I know what could happen, I'm going to be prepared to respond to what can happen. Then I'm going into response mode, and then recovery. Recovery is ongoing. Recovery is so ongoing, and we're not always, there's not a time that is connected to recovery, but here it is. You have to be determined to be better on purpose. And that is the recovery aspect of it. In the world of disaster services, we say recovery is getting you back to the place of normalcy. Next slide, next bullet, please. Getting you back to the place of normalcy pre-disaster. But man, I believe that we need to be able to push that, because some people keep going through the same cycle of disaster because their normalcy was always operating in disaster mode. And so we have to, as a church, recreate normalcy. Again, be better on purpose, raise the bar as it relates to the expectations of what recovery is going to look like. And what I believe what's important relates to recovery is if you can go backwards into the cycle and you learn how to respond, you learn how to take care of yourself. If you are prepared, the recovery is better. Think about it. The more prepared you are, the less the struggle is in the recovery process. When the church gets in place that we understand the cycle is ongoing, the struggle for recovery will not always start back at one. It will not, you will not have to always go back to the beginning, because preparedness changes both the response and recovery. It changes both the response and the recovery. Next slide, please. And so here is, I talked about this a moment ago, but let me stress this. Let me stress how important it is. The emergency app from the alerts from American Red Cross. What American Red Cross is a partner of ours as with Full Gospel, instrumental partner, because training, because they train, because they need partners. And here is what is key. Red Cross for so many years had the reputation of not taking care of us, not responding to the African-American community. And so Red Cross now is in position, they want to work with us. They want to be the partner of the Black community, because one, we're underserved, and two, the money that has been passed out for so many years never came by or through our congregations. So we push them now simply because they're trying to do something that I think is extremely key. Change the face of the responder. That is so key, and that's going to come by way of the churches. So often when we are the ones that need the help, but we are not the ones providing the help. And if you will go to Red Cross and begin to go through the process of training and see the things that they have available, starting with the app of just understanding what's out there, you can join this process of changing the face of the disaster, or changing the face of the responder, because oftentimes we know where they are. We know where the help is. They are sitting in our congregations. And when we can, be in partnership with those that have been doing this for years, we will put ourselves not only just in position to make sure that our communities are taken care of, but that we are the ones taking care of our community. Do yourself a favor and begin your process. Simply, I did this a couple weeks ago for my congregation. I said, right now on your phone, I want everybody to take out their phone and download the alert system by American Red Cross. That started a process of preparedness. That started the response. That said, if I'm in Arizona and I have a daughter in North Carolina, I get a notice when something is coming her way. I get a notice when something is coming away. Again, let me say this as I prepare to close. It's good to be able to have an alert system, discernment in the world of disaster services that is going to position us as a community to do better. We do not have to recreate the wheel. We are now partnering with people that have been doing this for years. Where we have lacked is our community has always been the one to receive help, but we are now in position to not only receive it, but to be in position to get it as much as the help is concerned and the finances that are attached to it. If your church is in a position, which we all should be, to go forth and be a partner, a shelter, some place to feed, we have to start someplace. And so we start by making sure that home is taken care of first. Do yourself a favor, download the app, that starts your plan, and then we'll share it across the board. Thank you so very much.
Thank you so much, Bishop Jester. And just to move forward, I'm sure there are going to be a lot of questions, so I'm going to do my best to actually try to go a little bit under time. I'm very glad to be here with you all today. Feel free to go to the next slide. Our focus as an organization is on the issue of preparedness and response, specifically from a healthcare and public health perspective, recognizing that for many individuals, preparedness for a disaster is just not something that can be top of mind when you are also contending with the challenges of the day. And so it is our job to make sure that we are making it as easy at the systems level, at the community level, and across partnerships to be able to not just respond, but to what Bishop Jester said, be able to prepare. I think some of my remarks are a lot easier because I'm going after the bishop, but I just want to first and foremost thank you all for having me, but thank you for having this discussion. I think it's incredibly important to spend time thinking about the role of churches in disasters before disaster strikes, because oftentimes what we find is that this will be a consideration, but there will not be a deliberate plan or established process in place. And then something may happen and the church may find that they have to spring into action. And that's where questions all the way from what is the greatest need, what is the need that we're going to be able to serve, to what are we insured to be able to do and deliver, really come into play. And so being able to have these plans in place in advance, very important. At the end of this, I have some resources, but I'll also touch on a few other resources that I just want to make sure we can leave with you all. Healthcare Ready has been around for about 16 years now. We were formed initially as a coalition during Hurricane Katrina, and we are a nationally focused organization. I'm very proud to lead the organization. We've been activated for a number of things, including COVID this year, but really what we continue to see is that when you are thinking about that 72-hour gap between the event happening and a full flow of resources at the federal or the national level being able to flow into a community, that's really that gap that we have to be more diligent about making sure that communities are prepared to fill on their own. And so that does not mean you are replacing FEMA. That doesn't mean that your plan is to supersede the State Emergency Management Authority. It means that you have a very clear vision of what that need is. And again, from our vantage point, we view every person as a patient, recognizing that while they may not have physical needs pre-disaster, mental, emotional, psychosocial health is as important post-disaster, and the trauma associated with surviving any disaster, as well as understanding chronic disease burdens and not just being directly impacted by the disaster and having health needs because you got hit by a tree or you were cut by debris in floodwater, but also you're a diabetic patient and you need to make sure that you have consistent access to your medicines. All of these universes of needs will continue to present during disasters, and it's our job to make that gap as small as possible to ensure continuity of care. Next slide, please. So that is Why we exist, that is our call to action. In the interest of time, I'm just going to move to the next slide, but I will take this second to say that the focus is on all hazards. So next slide, please. This focus is on all hazards. And so our focus is not just one particular type of event. As Bishop Jester said, depending on the portion of the country that you're in, there may be different disasters that are of greatest concern to you. So if you're in Arizona, you are more concerned about wildfires than a hurricane. But if you're in Louisiana, you're probably going to be more concerned about hurricanes and possibly tornadoes. But if you're anywhere in the United States, you may be worried about a type of classified disaster that we don't often talk about, but we're living in right now. Chemical, biological, radiological, or nuclear events, otherwise known as CBRN. A biological event like a pandemic, whether it is man-made or naturally occurring, creates a strain. And part of the reason that the situation that we're in is so unique is because it creates a strain everywhere. So when we're dealing with a wildfire in Arizona, we can flow resources from Louisiana. But when you're seeing a universe of needs where everyone has a need at the same time, the question is, where do the resources come from? And so what we do to help, really, it ranges from the systems level down to patients, but really our focus is on systems and institutions. Our thinking is, if our first phases are on really thinking about how we stabilize the system, how we can support the community serving institutions, how we can think about restoring operations of healthcare in the midst of a disaster, the patients that end up coming to us should really be few and far between. So that's really our focus, but it's making sure that we are serving as an effective enabler to you all. Next slide, please. So the current trends, and I think we've touched on this, and I think a lot of this is not new information for any of you, but I do think it's important to see it all in one place, in part because it's important to recognize the different factors. And I often hear people say, who would have known that a pandemic could happen? Who would have imagined? There are people who have been imagining and planning this for many years. The function of awareness versus readiness and planning is really where we lacked. And so if you think about this year, there are a lot of folks that have said, oh my God, 2020, there's so much going on. But if you actually think back just a few years, it's not hard to recognize that we have been in an upward trend of more severe events, more overlapping events, and greater impact to communities from events for at least the last 4 years. Thinking about this a little bit further, that emergency management life cycle that Bishop Jester showed, one of the things that I think is really important to highlight about that is that not all of those steps are of equal timing. And when you look at a recovery window for a catastrophic event, the average time for full recovery after a catastrophic event is actually 30 years. So ask yourself, what has happened to allow for Louisiana or New Orleans more specifically to be able to recover in the 15 plus years since Katrina, because they would still be considered in some state of recovery. So what is our emergency management plan going to be, and how do we pivot, recognizing that we are in this new posture? Next slide, please. And a part of our plan is dealing with all of these things happening, but happening overlapping. And so we have to look at all hazards planning based on two things, likelihood and consequence. So as we talk, one thing that we know, and Healthcare Ready has resources on this on our website, is that if you actually just ask people in a community, they have a very good sense of the types of disasters that would disrupt their system. And I just want to be clear about, when we talk about disasters, not everything is a disaster. Part of the definition of a disaster is the ability to overwhelm the community's system to absorb the shock. So if you are impacted by a tornado and there's some minimal damage, but everyone is safe, everyone is able to continue to get to the grocery store, healthcare has continued to operate, and you just have mild cleanup, while that is an event, it is not a disaster. So part of the actual definition of a disaster is our ability to manage it. And that comes back to all hazards planning. So we have to think about what is likely, and then we have to think about the consequence. There are a number of events that we may think about and say, there is a strong likelihood. For example, there's a strong likelihood that Florida could be impacted by a hurricane. But if it's a category 1, the consequence of that hurricane may be low because Florida has systems in place to be able to respond. there's a low likelihood of a pandemic, but the consequence is so high that it's catastrophic. So you use those balances to say there are many, many things that could happen, but what are the likelihoods? And then what would be the consequences? And my guidance is always you plan for the high likelihood, mid to high consequence, but you also have a plan in your back pocket for the low likelihood, high consequence events, because that may be the thing that only happens once every 20 years. But guess what? When it happens, the consequence is so great that you may have to make sure that you have resources in place to adjust. Next slide, please. So this is, I put this into place and I'm going to talk through it, but the point here is to make sure, and these slides will be left with you all. The point here is to understand that there is a system for this. And as we talk about the life cycle, you can start with mitigation. I often say mitigation is really about partnership with your local authorities, because what you need to know is what your system is prepared to handle. What does your local emergency management have in the way of creating mitigation plans? What is your planning department? A planning department at the city or state level is such an important part of understanding mitigation, because if they're building strategies to deal with flood, if they're going to move people who live in high risk flood zones out of those zones, that's mitigation. You're planning for everything else. And so you do that likelihood consequence piece, that's the hazard analysis. And then you do that vulnerability assessment to be able to look at your infrastructure in your community and say, for these events, these high likelihood, high consequence events, these low likelihood, high consequence events, what would we be most vulnerable to, and what parts of our system would be strained? There are a lot of churches that, for example, my home church where I grew up, when the church was first founded, everyone lived in the surrounding community. But as people began to remain connected to the church but build their families, they moved further and further away from the church. And so one of the things that we realized in that plan is one of the biggest vulnerabilities is going to be the question of who's going to be closest to be able to open the church. If you're thinking about people who are 10 or 15 miles away, normal commute, that may not be a problem, but during a disaster, that creates an immediate barrier, just as an example. And so you use those constraints to build your emergency response plan. This is a great time to also just dovetail on Bishop Jester's point. NAACP has created a climate justice and emergency management program, which also does deliver a certification. We did that. We helped them develop that in partnership with FEMA and others. Highly recommend looking into that as a resource. Also recommend having members of your congregation actually go through the Community Emergency Response Training Program, or the CERT program. That is one way to make sure that you are getting all of those nuts and bolts from a community piece, but also understanding what's expected of community organizations so that you can be more informed in building your plan. Once you build a plan, then it's about making sure that you are testing that plan. It is critically important to make sure that you are testing the plan. If you're not testing the plan, you're not going to know how to improve it, how to refine it. That's a part of that continued improvement. Next slide, please. So again, leaving these steps with you all, but all of this is happening within the realm of preparedness. You shouldn't be revising your plan during a response. If you're revising your plan during a response, there is a problem. So you're really focused on using the time between events to make sure that you're building that plan, testing it, training people on the plan, and continuing to evaluate it. Next slide, please. The policies and procedures, I just wanted to make sure that I also left this as a resource. There may be times where your plan is to not be open, and that is okay. But you have to make a plan for what it looks like if you have to evacuate versus shelter in place. How do you document what the policies and procedures would be? And also, how would you make sure that you're dealing with the safety or the needs of staff or congregants? So just the basic tenets of policies and procedures. We always recommend that you have this in a laminated book. You laminate it so that if it's exposed to water, you still have the ability to read it. You can wipe it off and read it, but have this in a laminated book, and having all of your trustees, having all of the major officers of your church have copies both at home, but in their car. You never know where they're going to need that plan. Next slide, please. And then the communication plan. I actually think there's a really important line between what you share with the congregation as it pertains to the details of the plan versus those who are operators in the plan. And part of the reason for that is if you include everyone in the plan, you're going to have to include everyone in the revision of the plan. But the communications plan is a really critical part of your plan because what you share with everyone, how everyone needs to know what to expect, who to call, what to communicate, what the redundancies are. If you can't find this person, find this person. Those are really critical parts of your plan. I recommend not putting this embedded into your emergency response plan, but making this an annex. That way you can easily pull it out and share this with everyone. This is another piece that should be updated annually. Next slide, please. Training and trusting, it's a fire drill. It's literally starting church service and having to do an evacuation. It's unannounced though. This is the only part that I want to make sure is very clear here. It's unannounced. If you tell everyone that you're doing the drill, you're going to get everyone on their best behavior. You need to make sure that this is a part of normal operations and only a few people are aware that this is going to change, because that's how you're going to be able to evaluate and assess the real use of your plan. Next slide, please. So I'm actually just going to leave these with you all, but I want to make sure that it's important that we touch on the fact that, and you can just scroll through these slides as I'm talking, that disasters are not going to create new disparities, but they are going to expose them. And so as you're building your plan, it's important to make sure that you understand which communities or which populations within your congregation are going to need the most help. Because if you plan to treat everyone equally in the plan, you will be creating a disparity because they may not have equal needs. Individuals with chronic disease burden, for example, may have more acute needs. And it's important to think about how you crosswalk the actual hazard with who would need more support. It's not that every hazard is going to create the same level of need. For example, in this particular pandemic, we've seen that there are certain populations that are going to have greater needs. Next slide, please. And so I'm leaving a slew of resources with you all. I'll continue to put some others in the chat, but I did want to make sure that you knew about the NAACP training. Also, Wheaton's Humanitarian Disaster Institute continues to put out a number of pamphlets and resources specifically focused on COVID to help churches as you prepare to support and respond. They are updating those on a weekly basis. And so we have a number of resources. The states and some of our United Way and 211 partners have resources specifically tailored to churches. And I just wanted to make sure that you were able to reference these. And this is our information. You're welcome to reach out to us if you ever have a need. Thank you.
Dr. Howard, you are still muted.
Thank you. And thank you for inviting me to come today and to be a part of this presentation. I'm glad that I'm coming last because so many of the points that I think are crucial have already been covered, and so I won't belabor them. What I'm going to talk about today really comes from some of the lessons that we've learned from some of the disasters in terms of Hurricane Katrina, which has already been mentioned, so I'm going to do that very, very briefly, as well as Hurricane Sandy. And 2 points of lessons learned there, I think, have implications for what we see today in the pandemic. Next slide, please. And so in the summer of 2006, I was asked to join a team to go to New Orleans to talk to public health workers, about 50 leaders that are involved either in public health or in medicine who are first responders. And we were really trying to learn about what occurred, particularly because since 2001, public health workers have begun to move more and more into the sphere of emergency management planning. Up until then, most of the public health workers had really been oriented around things like surveillance and health planning, health management. But after 2001, that changed, and there was training across the country from about 2001 to 2005. So we really wanted to see in 2005 to 2006, what actually occurred there. Next slide. And there were some real lessons learned that were gripping. We asked for people to tell their stories, and their stories they told. Someone mentioned about the difference between 2005 and 2015, and I showed photos that really show the difference on one particular street. But I also have this photo here because the streets and therefore the basements were flooded out. And most of the times in public health, we think about the problems of mold and mosquitoes, but there were also other issues. Next slide. And one of those issues was records. And I had a long discussion with the person in the records room who had records in downtown New Orleans dating back over 100 years. And I went through some of those records with the young woman who stayed behind when others left the city to be able to think about the fact that, you know, our records are in the basement. What are we going to do? And she said there were few people left in the city at that time, but she thought we've got to move the records up from the basement floors to upper floors. And even though they moved many of the boxes, they weren't able to move everything out of the way of the water. That's an important point because, as many of you know, the aftermath of that terrible incident was that people were all around the country without their records. And we're talking about all kinds of what they called, to that point, vital records. They've now even changed the name in the field of public health to essential records, because we know it's not just the vital records, but essential records. And actually, all of us have those kind of essential records. The question is going to be, where do we store those records? Next slide, please. This is a photo of Hurricane Sandy in the Rockaways in New York. And Hurricane Sandy hit us very hard as well. I'm here in New York. And one of the agencies, a community-based organizations that I was working for, had the same issue that occurred in the city of New Orleans. Most of their program records, the older records that they weren't using day to day, were stored in a basement. And so when this storm came along, not only did it hit the basement, but it actually went 6 feet up so that their entire offices space was destroyed. Now, what did that mean? Well, they were an organization that worked with women that were high risk for poor pregnancy outcomes, the most vulnerable. And the records that were really critical records to follow up care were gone. Not only that, they weren't able to follow up and find out what was happening to the women in that community because they lost their contact information. Most of their records were paper and not electronic. Next slide. And so one of the two issues that I saw that were really important coming out of looking at those two disasters was the importance of partnership and the importance of managing really vital, or now what we call essential information. In regard to partnerships, those organizations and agencies that were working with others found that they had support that they needed. And so often, and we've talked about it in several of the talks today, it's often so key to make sure that you have partnerships in natural disasters and in something like COVID. There are government agencies, there are service providers, protective services. Here we're talking about police and fire and related organizations. Our other religious organizations, so just not our own and just not necessarily our sister churches. And then there are fraternal orders, there are professional groups, as has been mentioned, the Red Cross, et cetera. There are opportunities for partnerships with churches, and we don't necessarily always reach out to them. But the opportunity is there, and also they're trying to reach out to the churches. And so this is a really important moment to do that outreach. And then next, on the individual level, are being able to reach out to our own families and loved ones. I know that some people talk about the fact that they're meeting more with family groups as a result of having to shelter in place. And then the next issue is making sure that we're keeping vital information on those in our groups, our membership, our clients, and that information that we're managing and keeping is somewhere that's safe in the event that there is a natural disaster, whether it's fire, and somebody mentioned fire, and I think that that's an important one to mention, as well as flood, and that there are records of key events and holding that we need to make sure in our churches are preserved. So I think it was just mentioned by the last speaker that laminating material is important, and that is another way to keep them from flood situations. Next slide. So what have we learned that we should take with us? Well, for instance, we need to know about our membership and where they are. And so we're in the process of conducting surveys to find out what are the needs. Someone mentioned, I think it was Bishop Jester mentioned about needs assessment. We need to do needs assessment in our congregations. We need to do needs assessment in our community-based organizations. We need to do needs assessment in our own communities and our families. What are our vulnerabilities? Who is at highest risk in our congregations? What kind of services do they need? How are they linked in communication? That's really important. We find that we think everybody is internet connected. Everyone isn't internet connected. So how will we reach them? These kinds of questions are important to a mask. And I say this and emphasize it because very often we have a tendency in terms of our culture to be very private. And we don't necessarily let people know what's going on. In the Katrina incident, one of the things that several workers told me, and they were very, very upset about this, they didn't have enough supplies for the people that needed to be served. But their job was to serve the most vulnerable. And they had conducted surveys to find out who was in the home, who was over 65, who were the children, who were the disabled. And that information was not always forthcoming. So when they had a list of information, they linked the supplies to the list. But the number of people who really had the need, who showed up with the need, were not counted. And so I think we need to begin to rethink how we respond to surveys and other means of gathering information about what the needs are seriously and where the lack and gaps of service needs. Next slide. And so I've kind of gone through this. I'll just talk about the fact that what I see now that's happening in many organizations is that they're staying current. Next slide. They're staying current with the members now and making sure that that information is online, but they're not working backwards. And I think that that's important to think about how you might be able to preserve information that's not the current information, but it's actually in the past. And that might mean having some volunteers to actually work on that and scan documents, et cetera, but it may be worth the while. The other thing that I want to point out, and I said this before, but I want to make sure that we do this in terms of our family group and in our own situations with our own records. Do you know where your important records are? Birth certificates, divorce records, land holdings, et cetera. Are they in a place where if there was a flood, if there were fires, et cetera, that you would have that information if you had to move? It's information that's really important. Next. And so here's some references. You'll have the slides. You'll be able to look this information up if you're interested. Thank you very much.
Thank you, Bishop Jester, Dr. Howard, Dr. Louis Saint, for excellent presentations here today on this topic here. I want to transition now into our Q&A section. So I will kind of go down some of the questions that are posed, and if they're directed to one of you, I will let you know. The first one, and I'm not familiar with this, it says, where can we get that pamphlet, 10 Commandments of COVID? And that's
And Chris, yes, I believe that's referring to our 10 Commandments for a Healthy Heart during the COVID-19 pandemic. We developed that specifically for our churches here in Minnesota, and it was also distributed via Essence Magazine. But I can also provide that to the Balm and Gilead for have for your churches.
Thank you. Our second question, it says, how can churches in urban areas like New York City provide COVID and other health-related issues during this time of closed buildings and no parking lots? we are doing what we can, but it does not seem like enough.
I'm happy to start with this one, if helpful. I think the first piece is understanding your network. So while there are many health needs and our normal response to a disaster is to get everyone in one place and have a localized impact, I think one thing that's really important is that as you connect with your congregation, as you connect with churches that may be connected to you or community organizations, you may be hearing about needs or seeing themes come up as you are making those touch points. That is very important for the public health department, for example, to be aware of, or maybe the local pharmacy or health system. So that's one piece. Being able to also push out good information. Oftentimes that doesn't seem as exciting as being able to help with other parts of a disaster, but especially right now, the challenges with making sure that people have the right information about COVID-19, that they understand how to get a test, what symptoms to track, what are the basic things that everyone can do to make sure that they are prepared. Those things may seem small, but they're tremendous. The other part that I would flag is especially in places like New York City, as they are preparing, and we're all working towards what it looks like to not just have therapeutics for COVID, medicines to treat, and some of those medicines actually can be treated in a pharmacy, for example, but also a vaccine. There's going to be a lot of need to partner with churches to make sure that people have the right information about those products, that they know how to access it, that they know who is eligible at what time, what the process is. And again, that may seem like it's not the, razzle dazzle of boots on the ground, but it's a really, really critical part in helping to deal with the medical needs that are evolving at this time.
May I follow that up, please?
Yes, please.
Also in New York City, um, the governor yesterday said that they want to work with churches for the rollout of the vaccine. They have an organization now in New York City called the Center for Faith and Communities, and that may be one vehicle in which they do that. But the intention is to work with churches. So I think it would be a great idea to be in partnership with them so you can get the latest information, and also you might want to be a part of the vanguard that helps to roll it out.
Bishop Jester, there was a question. You had mentioned that to get funding, you need to have people that are certified. And so one of the questions was saying, how do you become certified?
So I think it kind of depends on the direction in which a particular congregation is looking to go in. So we can't just chase the money without, being able to state that we have a level of expertise in a particular area. I think one of the simplistic ways of doing it is, again, based on partnership pre-disaster, right? And so if you can look around your congregation and decide that you could become a shelter, so that's a huge need. So in the time of a disaster or response in your shelter, then there are dollars that are available when something does happen. But I think the key is to find out the level of expertise of what you could do. And then as we are making partners prior to, again, pre-disaster, then it just kind of lines up. But it would definitely kind of determine on your capabilities, to know what you could do. And so many of our congregations are set up as shelters, as food distribution centers, and so forth. And I think one of the things that were put in the chat earlier was about Department of Homeland Security, or as it relates to faith initiatives. And so there are places where there are grants and things that are available, but they're available based on experience. And so I think that that's key, that we not just go after the money as much as making sure that we have a track record, as this is what we've done. But I did see something listed in there from one of the White House initiatives that came out years ago from President Bush, that says that there are places to do it, but it's about partnerships. And then Dr. Neglect, I think you posted something about BOAD. So we put things in the chats of where you have to become partners and be able to get at the table, right? And then money comes as a result of partnership.
Follow up to that question, someone also asked, would you be willing to share your church preparedness plan with us?
Of course. Of course. I did see some other things in there too about plans, but yeah, for sure. We'll make that available.
Okay.
You're on mute, Chris.
I'm sorry, the second question was, what is the exact name of the Red Cross app? And this is open to anyone. It said, I see that there are several Red Cross apps when they, I guess, looked it up.
So the one that I referenced, good question. The one that it's called Emergency Alert. Just pulled it up real quick. So yeah, Emergency Alert, and you'll be able to kind of, it's very simple to be able to just list the information.
Okay, thank you. Dr. Howard, there was a question. You talked about vital and essential information. Someone has asked, would you please define or give examples of essential information?
Yes, essential information might be your membership roles, your contact information for members. It might be your needs assessment, data. Certainly data needs to be preserved. And so that's essential, but not vital. That's the difference. Vital would be your death certificates and birth certificates. But you have other information, deeds, the deed to the church, that kind of information needs to be somewhere. And I know that years and years and years ago, decades ago, we used to talk about strong boxes, et cetera. We don't hear that much talk about it now. I don't know that it's done. So where is information like that being kept? So that's what I meant.
Dr. Lewis, this question says, what are some suggestions for integrating the needs assessment with assets that already exist at the community and individual levels?
Sure. So I'll take the community first. There's one thing to have a plan, and then another thing to think about how your plan connects to other plans. So what I would suggest is, as you do that vulnerability assessment and determine what your plan needs to entail, then as you're going through those components, if there are specific parts of that scope that you say, well, we don't need to be a food bank because we know there's a neighboring, organization that has a food bank on a routine basis. So this is where we would partner. That's where you forge out a partnership. There's also going to be a difference between thinking about, from the vantage point of your plan, that individual piece, how you take care of your congregation versus what your church as a tool of service to the community is going to be able to do. I would recommend starting with taking care of your congregation first. And so having an understanding of their individual plans, what you would want to or would recognize in that hazard vulnerability assessment would be the needs that many of your members may come to the church for. It's going to be critical, because it's only going to be once your congregation has their needs met that you're going to really be able to support the community needs. So that's how I would recommend doing it, and using those points of coordination to say, this is where you proactively begin in your preparedness plan to reach out and strengthen relationships and establish partnerships with local community organizations.
Thank you. This question is actually open to the floor, the panel. It says, is there a specific group or team that may be recommended to lead the preparedness plans, evacuations, or drills? And should a copy of records be stored off-site?
So our organization does this. I would say there are many organizations that do this. There are also many consulting firms that do this. I would personally not recommend spending money on this until you begin to work through this yourself. Even as an organization that does this, for other organizations, I don't think that it's worth what most organizations try to charge churches to create a plan, just being very transparent. There are many resources that exist. For example, on our website, there are a lot of resources that get you through the first few steps. There are a number of other websites that are like that, and I can make sure to go back and share those with you all. But I think that's where you start. And then, the second part of that question, Christopher, was about the off-site, on-site. Is that right?
That's correct.
So my guidance is, if you can afford it, a lockbox for your church with copies of vital records makes a lot of sense. If you cannot, having at least 1 or 2 officers in the church who preferably don't live on the same block. This has happened in plans. That's why I'm flagging it. Don't live on the same block. Having a waterproof, fireproof safe with laminated information is important. Also making sure that more than one person in your church knows your insurance broker and your banking information. There are a lot of things that can be figured out if you have those 2 pieces of information. There are a lot of additional documents that can be found, a lot of things that can still be done, but you need to have those.
Thank you. Bishop Jester says, is there a website to find a centralized disaster response agency that works with a designated faith-based organization, specifically in your county, or do we church with our local Baptist organization?
So I don't know of a specific organization. Someone else might be able to jump in on this that works specifically with faith-based organizations. Again, kind of depending on where you fall as it relates to a Baptist organization. We will definitely put my information in there because we are in line to help, not specifically Baptists, only, but we are in line to help. And I do know that the National Baptist Convention also has a division that does this. So many of our parent faith-based organizations have a disaster division. But again, we'll share my information as it relates to just helping make sure that the church as a whole understands the process. But I don't think there's a specific one set up for faith-based as it relates to churches. Outside of, go ahead. I think you're going to say go ahead.
No, please go ahead.
So outside of what I think of the website, and I don't have it ahead of me, but you posted the website of the faith-based initiatives, right? And so I think that would be a place to go, but it's not. I think the question that was throwing me off was Baptist. So that's a place to go to just understand that there are help for people of faith and how we put together plans.
One thing I've seen in the last 2 years that I think is expanding at the state and county level, every state and county level emergency management agency has a liaison that is intended to be the community liaison. How good they are at their job is a different story, but it's one office that's intended to reach out to everyone. But they have what's called a VAL, a volunteer agency liaison. And so if you reach out to your state or county, I would say the county emergency management agency is where to start, and you build a relationship with that VAL, that volunteer agency liaison, that's really their job, is to be that resource to you on all things emergency management and to be your direct line to get any information you need from them.
Thank you. This next question is kind of a loaded question, but it all has to do around the COVID vaccine. So the first one says, our church is being asked to participate in early testing anywhere with the shot in the United States. And the second part is another question says, what kind of conversations do we need to have with congregants to change the mindset of persons who have already decided that they will not have the COVID-19 vaccination? And that's open to anyone.
Well, so let me just kind of deal with the back end of it as it relates to, I think we have to share as they're going to be coming to the church for good information. And so I think it's not, my role is not to tell you to take it or not to take it, but it's to provide good information. And so one of the things that I refuse to do is own the responsibility of saying pastor said or bishop said, but we have to be a place where we can just make sure good information gets out there and just allow people to make their own decision. And so for me, it's just about good information and not pushing it one way or another.
There is, I would say the first part of that question, I just want to give a technical adjustment because I think that's a big part of how we make sure that we are getting that good information out. There's no such thing as early testing of the vaccine. We're still going through the trials process. And so if what she meant is the process of doing the trials that are determining whether or not a vaccine candidate would be approved, that is a process. But I wanted to make that point because with the long history of medical mistrust in the Black community and the problematic arc of clinical trials, specifically with people of color, early testing has a connotation that we have to be very mindful of. I know there are partnerships that have been set up with some churches and some regions of the country focused on clinical trials participation. And part of the reason for that is making sure that in that highly controlled and regulated environment of a clinical trial, if there is going to be anything that is seen as it pertains to any type of adverse events or anything related to the uptake of that vaccine candidate in communities of color, that it is happening during the trial and not after the vaccine's already been approved. So there has been some work there. But on the second part of it, I do know that there are some organizations, including not just within government, but also in the private sector on healthcare sides as it relates to trade associations and advocacy organizations, public health organizations, and even the pharmaceutical industry working together to make sure that not only are they talking about these potential vaccine candidates, but also talking about overall participation in clinical trials, the changes that have been made to protect people and what to think about when you are making a decision about getting vaccinated, whether it be for the flu or also for a COVID. I do want to lift up the work of the National Black Nurses Association that is doing a lot of work specifically on this and thinking about messages. And I would encourage you to consider them as a partner because they are making a lot of headway in doing this work specifically for the Black community.
Thank you.
I also wanted to add just quickly, so Dr. Lewis-Saint, you said it beautifully, that I guess what's undergirding this comment is kind of the medical mistrust that exists within the African-American community for a number of reasons, related to, the Tuskegee syphilis study, the Henrietta Lacks cell line. And I think that we as healthcare providers and medical institutions and governmental agencies all work even harder to become more trustworthy, not necessarily just trying to build trust and trying to get the community to take this vaccine, but why should the community trust us? And I know I want to give a shout out to the National Medical Association, who's also working very hard to ensure that there's safety with these trials, the clinical trials for the COVID-19 vaccine, and also that we as a community also gain access to not create disparities, as Dr. Lewis-Saint mentioned in her presentation. So I think, again, we need to work harder as medical institutions to build trust and become more trustworthy with our communities before we launch any kind of vaccine.
Thank you, Dr. Brewer. Dr. Howard, there was a question that says, wants to answer this question. Like the question was, is Referred Center for Faith and Communities a FEMA organization?
Yes, that organization comes out of the mayor's office. So as far as I know, it is not a FEMA originated organization, but it's a civic organization out of the mayor's office here in New York.
Thank you. So our time is getting near here. So what I want to do at this point is give all three speakers room to have some final words or final remarks here.
Before we go into it, I saw one question jump up about the emergency preparedness manual. Sorry to interrupt. We that in the chat, the emergency preparedness manual that we distributed to our churches here in Minnesota was through the Humanitarian Disaster Institute from Wheaton College, and Dr. Lewis Saint was one of the co-authors on the materials that they provided to the faith community. So we certainly can put that in the chat. And I encourage you to please use that manual. Our churches have loved it and has really given them a framework to start at ground zero from building their emergency preparedness teams within their churches. Thank you.
Thank you. So how about we go in the order that we spoke? So we'll have Bishop Jester give final remarks, then Dr. Louis Sant, and then Dr. Moon Howard.
Thank you. So I looked up real quick. So this was a resource I was talking about, faith-based community organization planning. So the Department of Homeland Security Center of Faith-Based and Opportunities has an amazing, again, resource out there that kind of takes you through it. I believe it was shared about a COOP, a continuity of operation plan. So to begin to start there and then work out your plan. For me, it is key that we start with making sure our people have a plan. And it goes from the people being planned. So again, from your house to the church house, I can't stress that enough, how important it is that we press making sure we have individual plans, and then that lessens the load on the church when and if something happens. So let's get to planning, and remember, it's better to have a plan that you don't need than to need a plan that you don't have. Thank you.
Absolutely. I'm just glad to be here with you all. Glad that you're having this conversation. I would just implore you, as you are pivoting to other sessions, to just think about two things that you can do or your church can do before the end of the year that will make sure that this is not just a one-time session, but a process that you are continuing to go through. I would urge the need to maintain community in all of this, not just because these are, daunting steps to take in building plans and building a disaster plan, but also that's how we really navigate and survive disasters, is by navigating them as a community. So I wish you all good health. I hope that you're able to remain safe in this season and continue to count on Healthcare Ready as a partner and a resource should you ever need us.
Thank you. I'd like to thank you again for the opportunity to share with you in this particular session. And I just want to emphasize the notion of partnership again, because we heard it coming up when it comes to participation in clinical trials, et cetera. It's really great to have partners that include the Nursing Association, the Medical Association, et cetera, being able to talk to people that you trust, and you trust because you've developed a relationship with them already. You're not waiting until a crisis, et cetera. So I think it's really important to think about partnership in multiple ways. And again, it's at the city level, it's at federal office levels, it's in professional organizations. All of them can become important. And then finally, this notion of needs assessment, I can't emphasize it enough to really find out about your membership and what their needs are prior to being in a major crisis, because that's how you can help the most effectively. Thank you.
Again, I want to thank you to all of our panelists. There was so much information. You definitely have to come back and probably review this and take notes. But I want to thank each of you for taking your time out to be a part of this talk on this crisis preparedness for our communities. I also want to thank my partner, Dr. LaPrincess Brewer, for her helpfulness in this as well. I think we've done our 4th year of facilitating these, and it's always been a great experience. And thank you, Dr. Seeley, and also to the Balm and Gilead. So I have a summary emergency preparedness slide, if Elder Carey can bring that up now. So these are the take-home points. And look at the word we, because that's kind of the most important thing. So we will get through this. We will get through this together. We will get through this together by being prepared. And we will get through this together by being prepared and ready to support our churches and communities. So we are always better together, and our strength is not in our numbers, but in our unity. And so again, I want to thank everyone who joined on this talk today. I am not sure if Elder Carey, if you need to have any parting words on your end.
Yes, thank you so much. Thank you for all who attended our session today. Thank you so much to Dr. Brewer and Dr. Pullins, and to our great panelists. I thoroughly enjoyed the session, so thank you so much. I was telling someone, I said Bishop Jester was really preaching that disaster preparedness. So thank you again. To our attendees, thank you again for joining us today. We want to remind you to take a moment at the completion of this session to complete our feedback survey. And after this session, please close this Zoom browser and return back to the main stage in our Healthy Churches 2030 virtual platform. We also want to remind you that our next Institute session begins promptly at 2:30 p.m. and you'll access that through our main stage in the virtual platform. And join us again this evening for our evening activity beginning at 6 p.m. Thank you all again for this amazing session. You all have a great rest of your afternoon. Bye-bye.